So, hello and welcome to the Naturally Managing Stress workshop presented by Dr. Nadine Gavin today. My name is Samantha from Clarington Public Library. I will be your host today. Dr. Gavin from the Oshawa Wellness Center will share many practical tips on how to manage stress naturally. Dr. Gavin is a naturopathic doctor in Durham region. She loves research and is active at the Canadian College of Naturopathic Medicine as a clinic supervisor and teaching advisor. She received her honors Bachelor of Science in Biochemistry and Biomedical Science from McMaster University. Her degree focused on understanding how the body works and how to critically appraise medical literature. She has completed research at Hamilton General Hospital, studying proteometrics and cardiovascular disease, and with the Robust Shard Naturopath Clinic in inflammatory bowel disease. Her passion for health led her to complete 4 years at the Canadian College of Naturopathic Medicine, followed by a 2-year clinical residency. She has worked at the and is now Nabe Health Toronto, Sherbourne Health Center, and Brampton Civic Hospital. She also has extra training in pediatric care and intravenous therapy. She has been published in Naturopath Currents and was featured in the magazine Mind, Body, and Spirit. She's board certified, in good standing with the College of Naturopaths of Ontario, and has prescribing rights too. She's passionate about optimizing women's health through hormone balance and mental wellness. So with that, I would like to welcome our speaker. Dr. Gavin, it's all yours.
Thank you so much for that introduction, Samantha. That's wonderful. So as Samantha mentioned, I'm a naturopathic doctor in Pickering and in Oshawa. And in Oshawa, it's out of the Harmony Health and Wellbeing Building. And I practice family medicine, but with a particular focus in women's health. And today we're going to be talking about natural ways that we can manage stress. So by the end of this workshop, I hope you feel a lot more comfortable understanding stress, what's happening in the body when we're experiencing stress, and natural ways that we can manage it. All right, so today we're going to talk a bit about me. So why I'm the person standing in front of you talking today about stress. We'll talk about what naturopathic medicine is if you're someone who isn't familiar with a naturopathic doctor and what they might do in their training. We'll talk about stress. So some facts about stress, why it's important to us, some of the things that we know in terms of what's going on right now with the pandemic and the prevalence of stress. We'll talk about types of stress we can encounter, and then how it manifests in the body. So what physical symptoms are attached to that stress response. And then once we get a really great understanding of how we can detect stress in our bodies, what we can do to cope with stress in a successful manner. Okay, so a bit about me. So Samantha did a wonderful introduction in terms of who I am and a little bit about my background. As I say, I'm a naturopathic doctor and I have 2 locations. So I practice in Pickering and in Oshawa. I also work at the Canadian College of Naturopathic Medicine as a clinical supervisor and teaching assistant. And a fun fact is the first Ontario naturopathic clinic in a hospital setting. So Brampton Hospital actually has a naturopathic clinic. I was a part of that project. So that was excellent. We hope to see more naturopaths in hospital settings. I also am a graduate of McMaster University, as Samantha mentioned. I've completed research in cardiovascular disease and inflammatory bowel disease. And I'm a mom of a 2-year-old daughter, as you can see in the picture, and a 10-year-old bulldog, Reggie. I also really like running, so that's one of my passions outside of naturopathic medicine. Okay, so what is naturopathic medicine? So it's great now because when I do these talks, a lot more people are familiar with naturopathic medicine or have seen a naturopath, but I always love to go over it for anyone where they're just hearing about naturopathic medicine for the first time. So way back when, I think when people heard of someone being a naturopath, they might have thought of something like this, right? You might have thought you were seeing someone who was not necessarily an accredited doctor, but now the climate around naturopathic medicine has really changed. So to become a naturopathic doctor, as Samantha mentioned, you do 4 years of an undergraduate degree. So I did 4 years of McMaster, followed by 4 years of postgraduate studies in naturopathic medicine. And then I completed a 2-year clinical residency after that. So during that time, you're learning the same lab workups and diagnostics that you would as a medical doctor, but the real big difference is how we approach a case. So naturopathic doctors really want to get to the root cause of your health concerns. So they want to understand why something's happening. So a typical example I give people is when we have a headache. Sometimes we'll go to our doctor because we're having this headache and we want to understand how to cope with the pain. So if you go to your doctor with a headache, you might be given something for pain relief, like an Advil or a Tylenol. If it's a really serious headache, you might be given prescribed medication like a triptan. And that's important. Certainly, we need to make sure that we're getting through our day, we're not experiencing the pain. But what a naturopathic doctor would want to do is also go one step further into understanding, well, why are you getting that headache in the first place? And if we can understand the why, then can we get to the point where it's not coming as often, so we're not experiencing that concern quite as frequently, and the intensity is improving? And can we get to the point where if we're using medication, we can use it even less or at a lower dose? So that's where I think naturopathic medicine and Western medicine work so well together collaboratively, is we both have these strengths that we really can thrive in. And when we work together to kind of get to the root cause of your chief health concerns, that's where we can really see people doing really well. So they're doing great. They're able to take the lowest dose of medications, and they're also able to get to kind of the why of their symptoms so they can make those lifestyle and diet changes as well. So in a naturopathic appointment, you're going to do a meeting. Usually it's around 60 minutes to 75 minutes. You're going to talk about your health history, your health concerns. We're going to talk about blood work, things we can do so we can really understand exactly what's going on in your body. And so we can get to an understanding of the symptoms you're experiencing and how we can correct them. The nice thing is a lot of naturopaths are now covered through extended health benefit plans. So understanding the coverage you have can make it so the appointments are a lot more affordable for you. We also do, as I say, blood work testing. So we can test hormones, we can test food sensitivities and a lot of different things as well, just to give you a lot more insight into what's happening in your body and some of the symptoms you're experiencing. So different treatment options. So we try to correct these imbalances as naturally as possible. So supplements might be something we talk about. So nutritional supplements or herbal supplements. Nutrition in terms of diet plans and individualized diets for you. IV vitamins. So if we run blood work and we see we're low on a certain nutrient like vitamin D or B12, we can do injectable therapy to correct those deficiencies. Acupuncture is another really great tool that we use to manage health concerns. And then calming concerns that we treat, there's a lot of different conditions we can help with, but specifically some of the ones we're going to talk about today that are linked with stress, like cardiovascular concerns, digestive issues, headaches, so migraines, hormone issues, all of these things, naturopathic medicine can work really well collaboratively with your healthcare team to get you really great outcomes. All right, so let's talk about some of the facts about stress. So now more than ever, I think stress is so prevalent, especially with the wake of what's been happening for the last year and a half. So this is something that really is important. I think before that, stress was already something that a lot of people were experiencing in their daily routine. But now we're noticing that it's even more of a concern for a lot of Canadians and individuals living in Ontario. So Stats Canada actually did a recent poll of individuals, and they found that 7 out of 10 people living in Ontario believe there will be a serious mental health crisis as a result of the COVID-19 pandemic. 50% of Canadians reported a worsening of their mental health since the pandemic. 44% reported feeling worried, and 41% reported feeling anxious. 1 in 10 Canadians said that their mental health had worsened significantly as a result of COVID-19. And when they did a survey of Canadian workers, they actually found similar things as well. So around 80% said that the pandemic was negatively impacting their mental health. This has also led to more Canadians using alcohol. So Canadians in the age groups of 35 to 54 had reported an increase of 21% of usage, and those 18 to 34 also reported an increase of 20% and higher. So what we were seeing is more people are using alcohol to cope with the stress, and definitely around those higher risk groups. So the people that were reporting anxiety and deteriorating mental health were reporting increased substance use. So definitely significant, definitely something that is impacting a lot of us right now. A bit of a comparison. So this is a bar graph that really kind of highlights everything we just chatted about. If you look at it, the dark blue was the exact same survey that Stats Canada put out in 2018. And then the light blue bar on the right was the 2020 survey that was put out during the pandemic. And what they were looking at is individuals' perception of their mental health. And as you can see, the individuals that reported good mental health, so about just less than 70% reported having a positive perception of their mental health. That dropped to around 50, just over 50% for individuals around 15 years of age. It was also significantly impacted from individuals from 15 to 54. So definitely we can see when you just compare the two bar graphs that everyone reported that their mental health had reduced significantly during the pandemic. This is a survey that was reported before the pandemic. So this is the survey we used to use prior to the pandemic when we were doing this talk. And this was just individuals that thought how often they actually experience their day as being extremely stressful or quite a bit stressful. And when you look at the ranges, you'll see that more than 30% of individuals from age 35 to 54 reported that most of their days are quite a bit or extremely stressful. And this was even before the pandemic. So why this is significant is a lot of people daily are reporting high levels of stress. And since the pandemic, this has only increased. This is, again, just another way of understanding it. So this was done a little bit earlier than that, 27%. And this one reported highly stressed. And then quite a bit stressed was 46%. 27% said that they didn't find their lives stressful at all. And this is something that I find really interesting to look at also, just because sometimes we're not perceiving the stress that's present. So when someone says they don't have any stress whatsoever, I think it's significant to get an understanding in terms of what's happening in their day-to-day life. And if there's someone where they really are living a really carefree life, wonderful. But so if they're really taking on a lot and they're just not registering the stress they're experiencing, that's where sometimes we can see physical symptoms occurring. So what is stress? So stress is actually a beneficial reaction that happens in our body. So when we come in contact with something that causes us stress, we have a physiological reaction in our body to cope with that stress. So the stress response is actually a really positive thing. The problem becomes when we're constantly exposed with stress, or if we're always experiencing stress in our day-to-day life, then we never get a break from that stress, and that signal can actually start to have impacts in terms of our physiology. So let's start with a quiz. I always love making this about the people who are participating. So let's see what your current stress is. So every time I say a statement, what I want you to do is just say if that statement refers to you or not. So if that's a yes statement for you, then you're going to score 1 for every statement that refers to you. So anytime the statement applies to you, if you're answering yes to that statement, you're going to give yourself a point of 1. And at the end of the quiz, we're just going to tally out how many ones we had. Okay, so the first statement, I frequently neglect my diet. The second statement, I try to do everything by myself. The third statement, I blow up easily. I seek unrealistic goals. I fail to see the humor in situations others find funny. I frequently act rude, or others have described my behavior as rude. I make a big deal of everything. So any of those statements that apply to you, just give yourself a score of 1 for each of those statements. That would be a yes. Next page. I look to other people to make things happen. I have difficulty making decisions. I feel disorganized. I avoid people whose ideas are different from my own. I keep everything inside. I frequently neglect physical activity. I have few supportive relationships. I use sleeping pills or tranquilizers without a doctor's approval. I get too little rest. I get angry when I'm kept waiting. And this one I think also applies to traffic. I ignore symptoms of stress. I put things off until later. That one's a big one for me. I think there is only one right way to do something. I fail to build relaxation into my day. I gossip. I race through the day. I spend a lot of time complaining about the past. I fail to get a break from noise and crowds. Okay, so hopefully we didn't go too fast. So any of those statements that applied to you, you were going to give yourself a score of 1 and then total up how many of those statements were yeses and how many yeses you got. So what does your score mean? So if you said yes to 1 to 6 of those statements, you're actually living a pretty stress-free life. So you should feel good about that. The one thing you might want to take into consideration is if you're living such a stress-free life that you're actually avoiding challenges just so you don't experience any stress. But otherwise, you'd want to continue in that environment. If you scored 7 to 13, you've got your life in fairly good control. You might want to work on the choices and habits that still could be causing some unnecessary stress in your life. And hopefully some of the suggestions in our presentation will help you do just that. If you scored from 14 to 20, you're actually in what they call the danger zone. So this was a survey that the Heart and Stroke Foundation put together. And they say it's the danger zone because that's when you do experience some of those physiological symptoms of stress. So that might look like headaches, that might look like brain fog, difficulty concentrating. It might even refer to high blood pressure, a lot of those things that can increase our risk of cardiovascular illness. And then if you scored from 20 or above on the test, that's what is referred to as emergent stress. So I hope we didn't score 20 or above, but if we did, then this is where I'm really happy you attended this presentation. We want to stop now and really think about how we're living. We want to try to really work on our attitudes and pay careful attention to things like diet, physical activity, and relaxation, because we really need to start making an effort of incorporating these things so we don't let the stress continue to run our lives. So the reason why I love that quiz is just because it gives us an understanding. Sometimes I think we become so exposed to stress in our day-to-day life that we just normalize it. So a lot of times we may think, I'm not really under that stress. And this can be kind of eye-opening to see, actually, maybe there's some present and some that we might want to consider strategies to help manage. So there's different types of stress. And one of the most common ones we think of with stress is kind of that survival stress. So I think the classic example is when you're in the woods and you see a bear, that reaction that happens in our body, like our heart will start racing, our eyes will dilate. We have that really physiological, immediate response to stress, and it's referred to as that fight or flight reaction. Now, in modern day situations outside of camping, where we might encounter something like a survival stress, is if we get cut off on the highway, kind of that immediate reaction that happens to our body when our heart starts racing, when we're clenching the steering wheel really tight, that would be a survival stress. Internal stress is the stress we process day to day. So kind of all the things that happen, our thoughts, all of those concerns we might have over finances or our families, our relationships, our work, all those things would be more considered internal stress that we have running in the backgrounds of everything we do day to day. Environmental stress is that noise. So if we're exposed to loud noises, if we're experiencing things that could cause stress on our body, like smoke in the environment, pollution, all those things can also cause physiological stress to the body. And then fatigue and overwork, that's kind of unchecked stress. So that's just when the stress is constant, you're never taking a break, you're never relaxing. That's when we can get that chronic stress picture. And we kind of chatted about the different sources of stress. It's different for everyone. A lot of us, I think, share common ones, but the things that cause us stress are stressors. And the thing that I think is really interesting is it can be different from everyone. Really, it's our perception that really dictates how much stress it's going to cause in our body. So how we view that event is really going to dictate how much stress is produced. So some signs and symptoms, things like feeling more anger, feeling anxiety, feeling really tense in our muscles. We can even notice sweaty hands. We can feel more irritable. Sometimes we just notice things that didn't used to cause us stress. Now all of a sudden we're reacting to, we feel really emotional. We can notice it present in our sleep. So we can have more difficulty falling asleep or staying asleep. We can even notice it in our ability to focus or concentrate. So what actually is happening when we say we're under stress? So stress is a hormone that's made in the body. It's called cortisol, and it actually comes from your adrenal glands. So your adrenal glands sit right on top of your kidneys. So you have two of them in your body, and they make adrenaline, and they also make the stress hormone cortisol. So when it's survival stress, that's when we're going to release that adrenaline. That's going to cause that rapid stress response. When it's chronic stress, or when it's more of those internal stressors, that's when we're going to release cortisol. And if we go on to have long exposures of the stress, that's when we can start feeling overwhelmed or fatigued. So you can actually test this. You actually can get tests done to see how much of this cortisol hormone is present in your body. And we can test it in different ways. We can test it in the blood. A lot of times those are extreme changes you're looking for. So if your body just stopped making cortisol, something like in Addison's disease, or if your body's making too much cortisol, like in Cushing's. If your body is under stress, and it's not necessarily a diagnostic condition like Addison's or Cushing's, what you can see is variations in your salivary cortisol. So this is a test that we can run to actually just see what's happening with our stress levels. And if we're noticing that throughout the day, our cortisol is becoming a lot more elevated, that's when we can see things like sleep disturbances. We can see things like afternoon crashes. So we wake feeling good, but then by 3 p.m. we can feel like we need a nap. We can see things, and we can see also the opposite of that when it's elevated for too long. So when it's elevated for too long and exhausted, that's when you see really low cortisol. Now, why this is important is because it actually also impacts other hormones in our body too. So we can notice that cortisol is also having an impact on things like estrogen and our thyroid hormone. Sort of, if these are things where you're actually experiencing physical symptoms and you want to test it, you actually can get that tested. The picture of the test that's seen here, it's called the Dutch hormone panel. So that's something that you could actually do in a clinical setting to just see, well, what's happening in my body? What's happening to the different hormones because of the stress, and what can I do to correct it? We chatted about the different phases of stress, but when we're thinking of that in terms of the adrenals, what that'll look like is, again, initially our body releases the cortisol to cope with the stressor. If we're exposed to that stressor for a long period of time, that amount of cortisol stays elevated. So initially we get that adrenaline reaction that we talked about. After a sustained period of time, that's when you might see things like irritability, anxiety, difficulty sleeping. If we never are coping with that stress, if our body continues to stay exposed to it, that's when, just like anything, the adrenals become, they say, kind of exhausted, but that's where you can see that dysfunction in the hypopituitary axis that actually makes cortisol. So when it's exhausted, that's when you see burnout. So those are individuals where anything feels overwhelming. That's that chronic fatigue picture that we might talk about. That's where those individuals, they often are exposed to stress for really, really long periods of time, and their body just can't cope with it anymore. So different ways cortisol can in fact impact our physiology is hormone imbalances, like we chatted about. So we can see it impact the thyroid. We can see it impact our estrogen or progesterone production. So that's where we can see things like PMS, or we can see irregular cycles or the loss of the cycle. For women who are perimenopause, we can see hot flashes. We can also see, as we say, it impacts the thyroid hormone, which is the metabolism regulator of the body. But when that gets impacted, we can see that our ability to lose weight is compromised. So a lot of times when cortisol is impacting the thyroid or is really high in the body, that's when we're going to have difficulty losing weight. So we can see us holding on to weight, specifically in the abdomen. We can have like that brain fog, difficulty recalling, and start feeling really, really tired. We can also see when we're chronically stressed out or burnt out, that low blood pressure and dizziness. So to chat a little bit more about some of the impacts it can have on our metabolism, I always like to talk about a study. So what they actually noted was, with stress, individuals that experienced high stress actually had more difficulty losing weight than individuals that had poor diet and lack of exercise. So this was a research study that was done in a company setting. They looked at over 1,000 participants, and they divided them into two groups, and they had a group of individuals who were doing diet and lifestyle changes, and they had a group of individuals that were doing the stress management techniques. And they actually found that the people who managed their stress lost more weight. So that's so powerful. I think we always think of weight and diet and lifestyle, but stress really can play a huge role in terms of how well your body can lose weight. When we sleep, we also lower our stress hormone, and we actually also have positive impacts on weight loss as well. So not only does cortisol impact weight loss, but it also regulates how our ability to perceive hunger and feel satiated with our meals is. So when we have high cortisol levels, we actually inhibit our body's ability to feel satisfied. So we crave more food. We also feel less satisfied with what we're eating. So we'll get more cues to eat, and we'll eat more because we won't feel satisfied. It also impairs our body's ability to actually store the sugar in our body and that food effectively. And that's where you can see changes in the body, like insulin changes or insulin resistance, and that can prime the body to chronic health concerns like diabetes. So managing stress, managing sleep, all these things have such huge consequences, not just on how we feel, but how our body works. So our cardiovascular system and our metabolism. So with this in mind, I know kind of one of those buzz fads are intermittent fasting. The whole idea behind intermittent fasting is, if you're someone who's chronically stressed and you have challenges actually getting rid of the sugar in the bloodstream, you may not want to eat quite that frequently, because it can make it more difficult to lose weight and to reverse this effect. So as we chatted about, when you're high stress, then you can get more of that insulin sluggishness, I like to call it. It's not necessarily insulin resistance for everyone, but your insulin's not working as effectively. So the sugar stays in the blood for longer. That means that the body's going to get the cue to store that sugar as fat. So if you're constantly snacking, it makes it harder for that body to then reverse the cycle. It just is constantly in that fed state. So there's constantly sugar in the body. If we try to do intermittent fasting, so the idea of intermittent fasting is to create a fasted window. So individuals usually stop eating around, let's say, 6 o'clock after their dinner, and then they don't start eating until the morning. And that'll create that 12-hour window where now our body can start to reset. So if this is something where you're having your blood sugar creep up, you're experiencing a lot of weight gain or weight loss, and this is something that you think might be playing a role, you can definitely talk to someone about how you eat, and if maybe that's something that we need to consider, is just not necessarily changing your caloric intake, but just priming your body to eat in a way that's going to work really well for its metabolism. So that's a bit of a history. Hopefully it gives you a little bit of an understanding in terms of what stress is and the physical impacts of stress. But really what I want to spend the most time on is, well, what can you actually take away from this talk? What can you do? What can you start doing to help with stress? So there's lots of different modalities, and hopefully we can kind of highlight how these different treatment options that naturopathic medicine has can really help with your stress. So let's start with the basics. So I think the basics to any good health plan is the diet. So you really want to make sure you have a good foundation in your diet. When we're experiencing stress, anything that increases that stress response or that adrenaline in our body works against us. So when we're thinking of things like caffeine from coffee, or if we're thinking of sugar, both of those are probably the two most common stimulants we think about. They actually cause more of that increased stress response in the body. So it causes more stress to the adrenal glands, making it harder for our body to calm down. So sometimes I'll have people who drink coffee say, you know what, I stopped drinking coffee in the morning. It's fine. It's not a big deal. But if your body is really, really prone to stress, even 1 cup of coffee can be too much for you. And that's where you might notice your hands starting to shake. You feel really, really hot when you drink it. You have trouble focusing. You feel really jittery. That can all be your body telling you that you have too much stress hormone, and the additional stimulant from the coffee is just not working for you. So for the time being, avoiding stimulants can really help to reduce the amount of stress on the body. Stress also takes a lot out of us. So it's exhausting. It burns your nutrients really, really quickly. So you want to make sure that when you are sitting down to eat, that you're eating nutritious foods. Now, as we talked about, this can be challenging because a lot of the changes that happen to our body when we're under stress, like feeling hungrier, having more difficulty feeling full, these make us crave things like sugar or things that are going to give us energy quickly. And that works against us when we're really trying to make those good health choices. So really focusing on nutritious meals that are rich in nutrient can really help to slow down this cycle. We want to stay hydrated, so drink plenty of water. When you do eat, try to eat in a way that you're sitting down to eat. You're not eating on the go. You're not eating at your computer screen. You're really eating slowly and chewing your food thoroughly. A lot of people that I see, they'll say, like, it feels like the food's just sitting on my chest, or I wake up and I feel nauseous. Sometimes in those cases, it's because we're not chewing our food thoroughly, we're not fully digesting our food, and that's where it can lead to a lot of those digestive symptoms that work against us. There's also a class of things called food sensitivities. So we can be sensitive to certain types of foods, and everyone's food sensitivities are different. It's not that everyone needs to avoid the same foods. It's about understanding what's happening in your body and avoiding the things that might be causing inflammation or stress on the body. So our bodies are really smart. Sometimes they give us those cues about what works well for us and what doesn't. So listen to your body. When you eat a really big pizza or really big, like, Thanksgiving meal, how do you feel afterwards? Usually you want to take a nap, right? Or you feel really full and not like you want to go for a jog, or you want to make those good health choices. So that's important. It's important to make sure that you're setting yourself up for success by choosing those things that are going to continue in that realm. How do you feel when you eat something like this? So things that are colorful, that have a lot of nutrients, often we feel a lot more energized, and that's when we feel like we don't get those same discomforts afterwards. So we chatted briefly about food sensitivities. There's really common ones. A lot of people right now are understanding that they might be sensitive to things like dairy or gluten. For anyone who doesn't know what a food sensitivity is, we kind of compare it to food allergies. Food allergies are that immediate reaction to food. So that's when you might notice like you feel an itch in the mouth, or you might, if it's a really serious food allergy, get an anaphylactic reaction. And those, again, they're very, very serious. But often we know which ones they are because of how intense of a reaction to the body we get when we consume those foods. A food sensitivity is a delayed reaction. So that's when we have something, and then it won't be until 24 hours or 48 hours that we start to notice that we're not feeling great because of that food. So that food's causing inflammation, and that inflammation can look like irritable bowel syndrome. So we might feel more urgency when we have that food. It might look like things like headaches. So certain foods can have been linked to causing our headaches, and it might even look like things like attention deficit disorder. So there's lots of different conditions that have been showing could have a link to the foods we eat, and it's about figuring out which ones are ours and then avoiding those foods. Now, not everyone has food sensitivity. So if it's something that you're suspecting because you've been dealing with digestive concerns for a long time, I definitely would reach out to someone. But if you feel great with the diet you have, I wouldn't worry too much about that. If you do suspect that you have a food sensitivity, you can do a blood test. So in the office, you get a requisition to get blood work done, and the blood work would tell you exactly what's happening in your body in response to the different foods you consume. So it's measuring the antibody that is produced when you consume that food, and then the ones that are producing high antibody reactions are considered food sensitivities, and they recommend just trying to moderate your consumption of it so it doesn't cause a lot of inflammation on the body. Now, sleep is another huge thing that we need to consider when we're talking about stress. So we chatted really quickly about how sleep affects the metabolism. Sleep is the body's reset button. So when we sleep, we help to lower our cortisol response. We help to repair the inflammation that happens throughout the day. Sleep is so critical for so much of what happens through our day-to-day life. As a mom, so having a daughter that's less than 2, I definitely can tell you how important sleep is and how different you feel when you're not getting regular sleep. So it's really, really important for our body because of those repair mechanisms. So if sleep is something that you're not seeing frequent, regular sleep right now, that's something to really try to work on or correct, just because it is so important. So kind of the rub of all of it is when we are under stress, it can make falling asleep more difficult. So we want to make sure we're prioritizing sleep. We're having that regular bedtime. We're winding down before we're trying to go to sleep. So we're helping our body to relax. We're doing things that are low stress activities. So for good sleep, we want to make sure our cortisol levels are really low and our melatonin, or our sleep hormone, is really high. So you want to shut down things that are going to have light. So making sure you have blackout curtains or not looking at your phone. All of those things are so important when you're trying to prime the body for sleep. You also want to be doing really low stress activities. So not looking at your phone, not getting into intense conversations right before bed, not worrying about that mental checklist, doing things like reading or a crossword puzzle, listening to a guided meditation, things that are going to really help to lower cortisol level and promote sleep, is really great strategies to have a great night's sleep. And cutting yourself off. I know now more than ever when we're working from home, sometimes we really stretch it and we say, you know what, I'm just going to do an hour more of work. Really make sure you set boundaries so you're managing that good night's sleep of about 7 to 8 hours. That's kind of the perfect amount. If you are currently struggling with sleep, reach out to someone, reach out to your healthcare team, and make sure that you have strategies to help you get that good night's sleep. Another thing, just to kind of chat again about the whole sleep side of things and how that affects the hormones in our body. Sleep helps to lower that level of ghrelin, so our hunger hormone, the thing that tells us how much to eat and be satiated. As we sleep more, we actually don't have as intense cravings the following day. So those are things that are important too, is just how we feel is not just a matter of willpower. Sometimes the amount of sleep can really dictate that too. So they found that people who had more sleep, so this picture just shows people who had 8 hours of sleep compared to people who had 5 hours of sleep. Those with less sleep had greater body mass index and had more cravings and felt less satisfied throughout the day. Another stress relieving technique that I really love is exercise. So exercise is funny because it's one of those things that it can cause a temporary increase in stress when you're doing something like a cardio activity, like a run. It can actually cause temporarily increasing stress. So you don't want to do that too late in the evening, but afterwards, it actually will lower your overall stress. So having a regular exercise technique is really great for those people who are high stress. You may not want to do it too late into the evening. The other benefit that exercise offers is it also releases our feel-good hormones, so those endorphins. Consistent exercise also reduces a lot of disease risk, so cardiovascular disease, a lot of those chronic illnesses, they are reduced when we're practicing that regular exercise. And it also helps to manage our stress. So find an exercise that you enjoy. It doesn't have to be going to a gym or an intense CrossFit workout. It can be something that like dancing, it can be yoga. So sometimes doing something that's not competitive can be a really great thing to just help get you out of your head and help to alleviate some stress. So as I mentioned, I'm a runner. That's something that I've found has been so great in terms of helping me manage stress throughout the pandemic. Another wonderful strategy is mindfulness. So being aware of what's happening in your body is the first step to understanding the amount of stress we have and helping to correct it. So that's all mindfulness is. It's bringing awareness to what is currently present in our body. When we're aware of how our body currently feels, that's when we can make active change to try to reduce the stress if it is present. So now there's lots of apps on our phones that can help us with this. There's the Calm app, Stop, Breathe, and Think app, Headspace app. All those are really great ones. They can really guide you through this process. But the key is you want to do it regularly. With mindfulness, it's that awareness that of what's happening in your body, but it's not necessarily that instant calm after that awareness comes to you. So once you understand the stress that's present, the more that your body is made aware of that stress, the more relaxed and the less cortisol is produced, but you need to do it repetitively to get its full benefit. Other things we can do adjunctively to really help with stress. So as we say, high cortisol, it can cause a lot of physiological symptoms, things like hot flashes. It can impair our ability to lose weight. So there are things we can do to help with our cortisol levels to help us feel more grounded throughout the day. Some of the popular ones that I use in practice are rhodiola or ashwagandha. I always say, whenever you're looking for a herbal supplement, you really want to talk to someone just so they can make sure it's safe for you. So talk to your medical doctor or your naturopathic doctor, because just because it's natural, it doesn't mean that it's safe. You want to make sure you're taking the right thing for you. It's not something that's going to have any impact on the medications or the pre-existing health conditions you have, and that it actually works well with what you're doing to enhance the benefit and increase your health outcome. That's the whole point. Some of these things, especially like St. John's wort, can interact with a lot of medication. So it's important that you do reach out to someone to make sure that you have the right the right recommendations. That being said, there's wonderful research to a lot of these things in terms of having benefits that are similar to anxiety medication, and really working complementarily with them to promote things like sleep and to reduce our levels of stress throughout the day. So they can be really, really great. Vitamins and minerals. So as we said, lots of stress means that our nutrients can get gobbled up really, really quickly. So things that can help to replace those nutrients can be important. If on blood work they show you're low on them, you can take an oral supplement to help to replenish that. There's also vitamins and minerals that can really help with those physical symptoms. So if we have a lot of headaches, a lot of neck tension, magnesium can be really helpful to relax the muscles. B vitamins are also really great for balancing out the hormones and really helping with our stress response. So that's another one that I often recommend. Vitamin C is also really great for that adrenal gland. And omega-3, so fatty acids, I really, really love as well. They're really great for that brain fog or that cognitive piece. If you're feeling like it's presenting as difficulty focusing, a fatty acid can be really good. So common omega-3 fatty acid is like a fish oil. Acupuncture is another really wonderful stress relieving technique. So acupuncture uses needles to stimulate different actions in the body. So this can be really, really great for helping with sleep, helping with calming us down. It's also really wonderful in terms of helping to balance out our hormones. Massage therapy. So now in the pandemic, massage has been available for quite a while, but I think that's wonderful, that ability to connect with someone to help with some of that muscle tension release. Massage can be a really wonderful stress relief and something that you put in your daily plan to help to keep you feeling grounded and feeling well supported throughout your days. I work with a lot of wonderful massage therapists as well. So if you ever need a recommendation, feel free to reach out. So hopefully that gives you some food for thought. So hopefully that you have been able to look at some of the different presentations of stress, being able to connect with whether or not those are the way stress manifests for you. And if they do, then at least start to brainstorm, okay, what can I do to manage that stress? I really hope some of the interventions also, you found at least one or two that you'd be willing to try or incorporate. And then if you do it regularly and you're seeing a benefit, then I really would be curious to see how that impacts that physical symptom of stress that you were experiencing. Breathing exercises. So that's something that I think is so important with kind of that mindfulness, the yoga exercise. It really talks about that breath. It's another wonderful thing that can really help to lower our cortisol. Making sure that you're actually taking a full deep breath can be really important too. A lot of us, we breathe in our chests. We want to be breathing into our belly. So if you ever watch a baby sleep, they know exactly what to do. You'll see that their belly is what rises and falls, not the top of their chest. A lot of us, we actually we're shallow breathers, and that can cause a lot of strain in our muscles, but a lot of strain on the heart too. So when you do sit down to try to catch your breath, if you're feeling like you're having a really difficult day and the day's getting away from you, and you pause and you're taking a few deep breaths, try to rest your feet on the ground. Try to put your hands on your belly, and just with the inhale, make sure that you're noticing that your belly's expanding, and with the exhale that it's contracting. That would be a really great way to know that you're helping to really lower your cortisol level. Remember that stress is perception. So a lot of people will have stressors, and not all of them are things that we can change, but how we perceive them and how we can react to them, we absolutely have control over. So taking that awareness and then trying to look at ways we can challenge some of those negative thoughts and help to really promote that positive thinking can be a really huge relief when it comes to the stress experience too. And don't be afraid to ask for help. If you get to the point where you're listening to this stuff and you've tried all of it and you feel like you just need that extra level of investigation or that extra support, feel free to reach out to your healthcare team. They're there to make sure they're creating strategies to really support your health and your mental wellness. Thank you so much for attending. If you have any questions, you can write them in the chat box and Samantha's going to help moderate that for me. But I'd love to, address any questions that might have sparked your interest or that you'd love to hear a little bit more about.
Thank you, Dr. Gavin, for very informative presentations.